Problems with regulation of blood sugar and prediabetes is one of the more common problems that I see in our patient population. There are 70 to 80 million people with prediabetes in the United States. And prediabetes means that your blood sugar levels don't quite reach the level that is needed to diagnose diabetes, but they certainly aren't normal. So first I wanted to talk a little bit about how we get to that point where the blood sugars are abnormal but not yet in diabetic ranges. So long before that, there is a maybe 10 to 15 year period where insulin becomes dysregulated and the body can become resistant to insulin. Insulin is a hormone, and insulin is released from the pancreas in response to meals that might be high in sugar or carbohydrates, and even protein can cause the pancreas to release insulin. And the job of insulin, every cell has receptors for insulin and then for sugar. So insulin basically binds to those receptors and then it opens the gates so that sugar can enter the cells. Now sugar in the form of glucose is very important because that's fuel for our body, for our muscles, for our brains, for our immune system, for our gut. So every system relies on that sugar. So sugar is not necessarily a bad thing. However, in our Western diet that's very high in sugar, processed foods, saturated fats, what ends up happening is we have much more carbohydrate load than we need for our energy expenditures through the day. So in that case, it takes more insulin released when we eat a high sugar, high carb food to get the sugar out of the bloodstream and into the blood. As we eat more of this sugar, the cells stop listening to that insulin signal. And I use the example of if you're sitting in a room and you just ate a banana and you put the banana peel in the trash. For the first 5 or 10 minutes, you're gonna smell that banana peel because it's a pretty strong odor. But after you sat in that room for an hour, you're not gonna smell it anymore because the body becomes adapted to that response. The same thing happens with insulin. So over time, and I'm talking over 10 to 15 years, it takes more and more insulin to keep the blood sugar normal. Insulin, when you're not using it for the carbohydrates for energy, as it rises, starts to give the body the signal to store fat. So we start to gain weight and hold on to weight, and it becomes harder and harder to lose weight. As we gain more weight, it takes more insulin to get the sugar out of the cells. So as insulin resistance worsens, we get fatter, and as we get fatter, the insulin resistance worsens. It's a vicious cycle. And this is why a lot of people run into trouble with weight loss once the insulin resistance happens. You have to address the insulin resistance or you can't even begin to get some of the weight off. So you've got this 10 to 15 years of developing insulin resistance. Eventually, even the higher levels of insulin can't get enough sugar out of the blood. And that's when we start to see the fasting blood sugar rise, or a longer measure of the blood sugar is something called a hemoglobin A1C, which is a 3-month average of your blood sugars. And it tells us how much sugar is glommed onto your red blood cells. And so red blood cells live in the body for about 3 months before they're destroyed. So it kind of gives us an idea of what have the sugars looked like for the past 3 months. So once the blood glucose and the hemoglobin A1C start to rise, you've already had this problem of insulin resistance for 10 to 15 years. The next step in the next 5 to 6 years, if nothing is done about it, people will go on to develop type 2 diabetes. The good news is that all of this is reversible with both lifestyle management, supplements, dietary changes, exercise, as well as even medications that can help prevent that progression to diabetes and help reverse some of that insulin resistance. Of course, one of the keys and the thing you can't get around no matter what else you decide to do is diet and nutrition. Sugar has invaded our lives. It is a drug. It changes our brain so that we want more of it. When we eat it, it releases dopamine, just like a lot of other illegal drugs, but it's super legal. And the more we have, the more we want. So cutting out sugar And when I say sugar, I don't just mean what's sweet. You know, the candy, the cakes, the cookies, the pop. All of those things are sugar, but so are pretzels and chips and bread and pasta. Anything that has been refined into a flour and made into any product is absorbed in the body as sugar very quickly. So cutting those things from the diet, limiting them in the diet, and really focusing on a diet that's really full of, 5 to 7 servings or cups of vegetables a day, maybe a fruit or two. You gotta be careful. It's better sugar, but it's still sugar. And cutting added sugar down to no more than 20 to 25 grams a day. The US government has told us up to 50 is okay, but once people are in this cycle of insulin resistance and prediabetes, you really have to cut to a much lower level. Making sure that if you're gonna have a grain, it's a whole grain, and really like I said, limiting those things in the diet. You don't have to cut them completely. That's very hard to do, and people do. You might have heard of a keto diet that really cuts most carbs. It can be very effective in reversing prediabetes and insulin resistance, however, it's very hard to sustain. So picking something that you can do and eat and live that way over the long term. The second thing is exercise. So exercise will bring sugar into the cells because your muscles need them to use right away without requiring insulin. So it's a great way to get some of the sugar and carbohydrates mobilized out of the bloodstream without needing more insulin to do so. Sleep is another great one. When we don't sleep at least 7 hours a night, our fasting insulin levels rise. Our fasting glucose levels rise. So poor sleep is a risk factor for blood sugar abnormalities. And finally, stress management. In some of our other videos, we've talked about the effects of anxiety and adrenal dysfunction and high cortisol levels on sugar because that cortisol is preparing the body for action and in response to a stressor. So the cortisol goes to the liver, and you can maybe not even be eating sugar, and the liver is going to make sugar in response to cortisol. So managing stress is a final lifestyle management tool to help with the blood sugars and prediabetes. Now, there are supplements that can help target blood sugar, help improve the insulin sensitivity and how well the body can use insulin and sugar, as well as address the glucose levels. And in some cases, we'll even use prescription medications, most commonly metformin, at least for a period of time to help reverse some of that insulin resistance. So there's a wide variety of things that you can do that you can start on your own to really help get your blood sugar under control and decrease your risk of progression to prediabetes and diabetes.